We're still in phase two, and we're going to be staying in phase two. We continue to look at what's going on around us and what's happened in places that have opened up more quickly. And everything we see indicates that it's harder to control this than people realize, that you just can't open things up and assume that everything you're doing is perfectly safe. We're already watching states roll back some of their openings, too many crowds, too much of a bar scene, and all of that's had a negative impact elsewhere. And so while we're watching cases skyrocket in a number of states and a general upward trend in the United States, we're trying to keep ourselves on a different trend. Hopefully our numbers will continue to come down, and when we get to a level that we're comfortable with and we have a better idea of how this is playing out every place else, we'll have a better idea what a path forward is. But it's certainly not the path that's been followed by a bunch of the states that are now having to walk everything they did back. And I don't want to be in a position of walking it back, because the reason you walk it back is because you spike cases. I'd prefer not to spike the cases and save myself and all of you the trouble of having to walk back previous decisions.
As it relates to COVID-19, to build on what the county executive has mentioned, we have reached some milestones in terms of testing. As of today, we will have tested 10% of Montgomery County residents, which is approximately 110,000 residents. We have conducted, as of this morning, over 125,000 tests throughout the pandemic. In addition, we continue to build up our testing apparatus in terms of building on our stationary sites, our mobile testing presence, our rapid responder presence, supplementing testing in nursing homes and assisted living facilities, our testing helpline that has been in place now for individuals who don't have a provider and need a referral. And we will continue as we identify other venues and schedule venues for pop-up testing. We will make sure that information is released as quickly as possible so that as many residents can take advantage of those opportunities.
As long as this continues, we're in a better place than we were. A couple of weeks ago, our numbers would have been close to 2.5 to 3 times these numbers, but we've reached another plateau, so to speak. And so we are lower than we were. I think the 34 number from a couple of days ago was the lowest number we'd had, I think somebody said, since April.
One of the things that I want to highlight is that, yes, we are encouraged by the trends in the data in terms of having lower daily, 3-day daily averages. So county executive pointed out just a couple of days ago, we saw the reported cases of 34, which was the lowest daily number that we had seen since the beginning of April. And consistent with that, the 3-day daily average was actually 47. That's markedly improved from where we were in the beginning of June when the 3-day daily average was 255. But we haven't seen significant progress further down from that, and we still see an impact of the virus, particularly in certain communities that have been disproportionately impacted both by race and ethnicity as well as by geography. And so what we have been working on from the beginning, and we continue to work on, is looking at strategies to be able to offer short-term solutions to address those.